The Closing the Gap podcast is produced by the Association of Nigerian Physicians in the Americas and is supported by the association, sponsors, and advertising. Hello, everyone, and welcome to the Closing the Gaps podcast, brought to you by the Association of Nigerian Physicians in the Americas, also known as ANPA. My name is Jason Prater, and I'll be your host for today. The goal of Closing the Gaps podcast is to highlight and to share the stories of physicians and healthcare workers in Nigeria and in the United States and how they're helping to close the gaps in provision of healthcare services to people who need it the most. We will also be thanking our guests for their tireless work, finding out what other steps they wish to take in the future, and to help make healthcare more available to everyone, and of course, how we can help too. Well, welcome back to Closing the Gaps podcast. We are super excited today. We have Dr. Aluko here on the line. We are going to learn more about him, more about his profession and what he is doing to close the gap in healthcare worldwide. And so, Doctor, welcome. We appreciate your time. We appreciate the efforts that you're giving to this. And so please introduce yourself and let us know a little bit about you.
Thank you, Jason, for the opportunity to share thoughts with you today. My name is Dr. Yele Aluko. I am a Nigerian-born and Nigerian-trained physician. I went to Ibadan Medical School, and after that, I obtained specialty and subspecialty training in cardiovascular medicine and in interventional and structural heart cardiology in the United States, where I currently am. So I am a US-based physician executive. I'm a health industry strategist, a health systems corporate advisor, a global health influencer and leader. I currently serve as Chief Medical Officer at the global health consulting firm called Ernst & Young, abbreviated EY for short. I'm also the director of the EY Center for Health Equity. I practiced cardiovascular medicine in the United States for 23 years, up until 7 years ago, after which I joined industry as a management consultant. And in the work that I do, I advise health system C-suite clients on strategy, business operations. I also provide insight on mega trends confronting the health industry in America to best position our clients for competitive advantage in the market. Part of the work I do involves global health development, and I am a global health development leader at EY. Additionally, I mentioned that I am the director of the EY Center for Health Equity, and in that role, me and my team, we advise our clients in the US in regards to developing competencies and solutions to close disparity gaps in the United States. But that work has extended across EY's other global practices in the UK, in the Middle East, and in Australia. So I am privileged to have this conversation with you today. I will say that having gone to business school about 14 years ago, that additional lens into the industry has given me an understanding of health industry optimization strategies and gives me an astute understanding of the complexity of the health industry ecosystem on the African continent in general, as well as in Nigeria in particular. So that's me in a nutshell. I'll stop there. And
Well, Dr. Aluko, you have accomplished a lot. Let's go ahead and say that. And first off, let me say on behalf of Closing the Gaps podcast and AMPA, thank you very much, Doctor, for your service. But I have a quick question for you. So, in regard to closing the gap with healthcare, where you recognize from Nigeria to America, I would love to hear maybe if you can give me a brief section of a story that has impacted you both here and there.
well, a story that impacted me in Nigeria. I was born in Lagos. I went
Yes, sir.
to primary school and secondary school in Lagos. The most impactful story that I can share with you is the story that led me to become a physician. And
There you
it
go.
was
Beautiful.
when I was about 15 or 16 years of age. My mother took me to go visit with her, a relative of ours, at the Lagos University Teaching Hospital. As we parked our car in the parking area and walked through the emergency department, I heard a taxi screeching into the emergency area, and four doors were flung open. The taxi driver runs out, opens the back door. The passenger in the front seat runs out. Gentleman says, "My wife is dying. Please help me." He
Mm,
rushes into the
wow.
emergency room, and the emergency room was very busy. Nobody could help him. He rushes out, and the two men carry this woman in their arms into the emergency room and put her on the floor.
Wow.
Eventually, she gets put on a stretcher. They give her first aid. Long story short, she died. She died
Mm,
there, right in front of
yes.
me. And
Yes, sir.
as a young man, that was so impressionable. And it actually led me to develop an interest in saving lives. I had,
Wow.
at a young age, the altruistic intention that nothing like that would happen to a family member of mine.
Wow.
So most
Wow.
people who go into medicine have some impactful reasons why they do so, either personal experiences or experiences through family members who may be in the profession. There are many impactful experiences. And in America here, there are several. Some of them are sensitive and some of them
Sure,
are
sure,
less
sure, sure.
so.
Yeah, absolutely.
I will say that when I was an interventional cardiology fellow in Massachusetts several years ago, having been a fellow for 6 months, doing pretty much 80% of the sophisticated interventional procedures at the time called angioplasties, I realized after 6 months that I had done a procedure on only one black person
Mm,
in a
mm,
city in Massachusetts that was a blue collar city that had at least a 35% of black people. And
sure.
I began having questions at that time as to why is it that I, as a black specialist at the pinnacle of a pyramid, having the most sophisticated training available in America, why were my skills not extending to the African American community in a
Mm,
manner that was equitable?
sure.
And that began my exploration into the complex ecosystem that drives health disparities within vulnerable populations in the United States. And that demographic of vulnerable populations include several subpopulations such as race, gender, ethnicity, the elderly, the disabled, women of all races,
Mm,
the homeless, different sexual orientations, people living in rural versus urban communities. And that led me to become a health equity practitioner throughout my career. coming to EY, I had no realization that I was going to be leading a line of business that I started, the EY for Health Equity. But that came out of our experience in COVID, when all of a
Sure.
sudden the world began to understand that
Yeah.
different populations had different experiences and different outcomes, even if they had the same type of health insurance.
Right.
So
That
there's
was big
several,
for
but
everybody.
those
Yeah,
two I think should suffice.
absolutely. And doctor, first off, thank you. Thank you very much for your service, your dedication. Um, when I sit here and I think of this, I do know we've spoken to several individuals who are younger, generations before us, generations of individuals who are seeking the profession of healthcare, and their heart beats what you just said. And so, if you wouldn't mind, what I would like to say is this. So, Doctor, you shared a couple of stories, and one of your stories for me was very profound. It was very heartfelt. And you experienced something where it made you capitalize. And you said, hey, I want to do the best that I can to help my people. I want to help my people. I want to help people abroad. And so, if there was an individual, let's say there's a college student right now who's listening to this, and as you being a seasoned doctor, if you wouldn't mind, would you give them maybe a quick 30 seconds word of encouragement and tell them about, hey, even though this is very hard, this is a hard thing, you can make it. And if you could give them 30 seconds, would you do that for me right now, please, doctor?
Well, absolutely. I have and continue to have mentees that seek advice in regards to career decision making in the health industry, as well as they progress through their professions. So I will say that first of all, if you want to do medicine, you have to understand within you that it is a profession and a vocation of service to humanity. Now,
Wow.
all
Beautiful.
professions bring
I love that.
value
Yes.
to consumers. The health consumer is inappropriately called a patient because I say that because there are people who are health consumers that are healthy. They're not patients, but the industry refers to health consumers as patients. Their industries in general bring value to their stakeholder groups. In healthcare, every single day, a doctor or a nurse practitioner or registered nurse or nurse's assistant wakes up in the morning, puts on their nurse's uniform, puts on their doctor's coat, opens their front door, gets in their car or
Mm,
gets in public transportation, and they
right.
go to work
Right.
every single day without equivocation. They are helping people live longer.
That's
They're
right.
helping people
That's right.
feel better.
That's
They're
right.
helping people and their families understand the importance of dignity in death and the ability to transition with
Mm,
dignity.
mm.
Now, that is unquantifiable human value that you
Yes, sir.
cannot codify in monetary terms. And I
Absolutely.
don't want to minimize the value of any other industry, but doctors and nurses and healthcare professionals do that day in and day out.
Well, you help provide life.
That is
That's
correct.
life.
That
That's
is
life.
correct. But I also want to emphasize that the health industry goes beyond bedside work. It's not
Absolutely.
doctors and nurses and patients. People that want to consider medicine should also be aware that there's a broad competency adjacencies within the industry from healthcare administration,
Mm,
people that can run hospitals,
yeah.
medical education, academic medicine, healthcare technology, healthcare consulting, healthcare innovation. So there's public health as well. And then there's also the other sectors apart from hospitals, such as the health insurance industry, the biopharma industry for research and development of drugs, the life science and medical device industry that innovates new devices that help patients live better and live longer. So
Absolutely.
it's a broad opportunity, and I encourage my mentees not to get locked into anything right now, but to understand, explore, and then gravitate to their best affinity point.
There it is. And doctor, please forgive my intrusion, but I loved what you just said right there. My mentees. Okay. So, fellow listeners of Closing the Gap podcast, we right now have a seasoned doctor. He is capable of helping individuals, not alone from his team, from his profession, but also for individuals that are maybe seeking to get involved within this field. And so please, doctor, if you wouldn't mind, 2 seconds, let us and the listeners know maybe some contact information for you. If you wouldn't mind, because you seem like you're a leader of leaders. So if you wouldn't mind, please share maybe a website address, an email address, or a phone number to where maybe somebody who is going to one day look up to you and say, hey, if this doctor did it, I can do it. This is tough, but you know what? I see it as worth it. What would you say to them right now, as well as sharing your information?
Well, I generally welcome the opportunity to be available for people who are seeking insight, particularly if my experience can enrich their potential.
Yes,
My
sir.
email address is my first name, which is Yele, Yele, dot. My last name is ALU, as an umbrella, KO. That is Yele.Aluko at E as in Edward, Y as in yellow.com. Probably best you send me an email if you want to reach out to me. I will guarantee you that I will respond. My cell phone number is not predictable because it has a robo-killer filter. So if you call me and you aren't in my directory, it will not get through. But emails, I'm pretty good at emails.
Awesome. Well, listeners, please, all of my fellow Closing the Gap participants, everybody who is tuning in, we have a very prestigious doctor on the line, an individual who is sharing not alone personal, but also professional things that have taken place to help him arrive where he is at. Hard work, dedication, seeing what's taking place in Nigeria, seeing what's taking place here in the Americas, and he is somebody who is helping to stand and to close the gap in healthcare. And so, doctor, on behalf of Closing the Gaps podcast, on behalf of ANPA, we thank you so much for your time. We thank you for your wisdom. And listeners, please make sure that you hear this information and reach out to this individual. We thank you so much for tuning in and hope you have a great day.
Thank you for your time. Thank you.
At this point of the show, we're going to be taking a break. Please stay tuned.
Have you ever considered plastic surgery? Do you have poor self-image or body pain due to excessive skin or fat? Do you consider professional cosmetic plastic surgery provided by Abuja Plastics? Besides concealing aesthetic physical flaws, cosmetic surgery has several physical and mental health benefits, including increasing one's self-worth, self-esteem, and overall quality of life. At Abuja Plastics, we specialize in facial rejuvenation, breast enhancements, and other contouring procedures such as liposuction, tummy tucks, fat transfers, and mommy and daddy makeovers. Our office is located at 276A Kofo Abayomi Street, Victoria Island, Lagos, Nigeria. Visit us online today at www.abujaplastics.com or email us at info@abujaplastics.com. ANPA Closing the Gap podcast listeners can get 5% discount on surgery fees and 10% off spa services when they mention the Closing the Gap podcast. Get your nip and tuck today at Abuja Plastics. M&G Etome Foundation provides skills acquisition programs, graduate HSE programs, and community sports and recreation programs for impoverished youth in the Port Harcourt area of the Niger Delta in Nigeria. Our goal is to break the harsh cycle of poverty in these rural areas of Nigeria by teaching the value of self-empowerment and improvement through our various programs and activities. To find out more about what we do at M&GE Etome Foundation, visit our website at www.mgesolutions.org. We also welcome your donations, support, and sponsorship also. Together, we can facilitate positive change and programs of sustaining development of youth in the Niger Delta community.
Thank you for staying with us till the end of the show today. This has been the Closing the Gaps podcast, brought to you by the Association of Nigerian Physicians in the Americas, or ANPA. Remember to follow us on Facebook and other social media platforms. Our social media handles are as follows: Facebook, ANPA National; YouTube, ANPA 8415; Instagram, ANPA_National. You can also visit us at www.anpa, that's ANPA.org, for more details about up-and-coming events. Finally, remember to join us next week for our Closing the Gap podcast, where we'll have a whole new set of guests doing amazing things to close the gap and make healthcare services more accessible to people in Nigeria and in the United States. Once again, my name is Jason Prater, and it has been a pleasure being your host today. And until next time, stay healthy and have a fantastic day.